dentistry, you provide a care where it changed lives. You know, you take their smile or something that's bothering them and you can fix it. And that's why you do it. You do it for the patients. My name is Dr. Crispin, and I've been a practicing dentist for 20 years, and I've enjoyed every year. I got into dentistry because my father is a dentist.
My name is Bruce Crispin, and I'm a board-certified prosthodontist and accredited member of the American Academy of Cosmetic Dentistry. And I've been doing that for 50 plus years. For the most part, my focus is on cosmetic dentistry, full mouth reconstruction. My case practice time would be probably a minimum of a half hour, upwards of about 4 or 5 hours.
Mentally, it takes a lot out of you. Patients are awake. You're trying to please them, but you're also trying to achieve the best dental results you can have while keeping your body in good posture. And it's exhausting. I mean, your neck hurts, your arms and shoulders.
And so I'm a real believer in ergonomics.
Ergonomically, dentistry has come a long way, but it hasn't alleviated all of the stresses on your back and neck.
Most of the dentists, when we get into the clinical component of our programs, in my opinion at least, have poor, I wouldn't even say good, probably poor, worse positioning or ergonomics when they're working. I really feel that body position is really one of the most important components of longevity in practice. And I've known a number of my students from UCLA that have already retired because they have neck pain and back pain and things that really have prevented them from continuing their practice. The NekSpine is a little bit of a unique piece of equipment. My initial response was it's kind of big and bulky, and there's a lot of stuff wrapped around you. But interestingly enough, I think once you get it on, it really doesn't seem that intrusive. And I think the fact that it gives you such nice neck support is really a real plus.
I think the bonus that I have really noticed is you don't notice during the treatment. You notice when you take the appliance off. And all of a sudden, the weight, like you feel the weight of your head. And you realize how much that actually, the NekSpine is taking that weight. When you're leaning over, it's actually taking that weight off of your body, and you don't feel as exhausted and tired as you normally would during a long procedure.
Immediately when I took it off, my head felt like a bowling ball. It felt just really heavy when I leaned over. I mean, I got used to having that support from the NekSpine, and when I released it, my head felt so heavy. And so obviously the NekSpine was really giving my head a lot of support. It just feels maybe a little more relaxed too, because I'm not really using a lot of muscles the way I normally would without using the NekSpine. If you're a dentist in their 20s, 30s, or 40s, or even maybe 50s, do you want to practice another 20, 30 years and feel comfortable? It is a time that you start addressing the things that could be potential problems for the future.
It's been 20 years, and I'm hopefully going to be able to practice for 20 more. My father's been practicing over 50 years, so we just hope that longevity continues forever. It's very important.
Anything that you can do, whether it's posture or the NekSpine technology, anything you can do to protect your neck and back, I think is really, really critical.